Our Health event called Mental Health and Addictions in the Time of COVID. We're so glad you're here. I suspect you're either joining us on your local Rogers channel, and that's available now throughout all of Simcoe County, or you're looking at your iPhone or your computer or your iPad because you've logged into a website either through Rogers TV or through Facebook Live. No matter which direction you came from, welcome. We're glad you're here. My name is Keith Rose, and I am your moderator. At this time, I'd like to introduce our three amazing speakers, and I'll introduce them in the order of which they're going to talk tonight. First is Rob Meter. I guess you'll all know which one Rob is there. Yeah, don't even need to raise your hand, Rob. Okay, Rob is a pediatrician who over the last few years has shifted his practice to mental health. After recognizing the gap in the care of kids challenged with mental health issues, he's been now working in the mental health field for almost 5 years. Anita Federici is no stranger to the Our Health program. She was here for eating disorders in 2017 and sleep disorders in 2019. Tonight, she's going to focus on the impact of COVID-19 on those with eating disorders, as well as other common challenges that she's seen in her practice over the last 14 months. Nicole Mace. Nicole is an organizational development consultant focused on leadership development and workplace safety and health. She interacts daily with healthcare providers at Waypoint who are affected in so many ways by COVID-19. So welcome to the three of you. Thanks for joining us. There are more detailed biographies on all of our participants in the electronic brochure you got. Take a look at it, pull it out now, copy it, keep it. But also in that brochure, we have 2 pages of references. The first page is a list of resources that you can access either through telephone numbers, websites, that kind of thing. And the second page is a personal list of references from each of the participants. I want to thank you all for putting that list together. Keep it beside your fridge, keep it on your computer, keep it on beside the telephone, whatever, but it's quite an extensive and it's an excellent list. So thanks for putting that together. I have some collective thank yous before we start. First of all, the Our Health Advisory Committee, and specifically Holly Archer and Larry Arnold, who spearheaded this program. I also want to let you know that the other 4 members, that's six committee members, are hard at work. We've got some exciting topics and speakers, and we're putting together the entire series for 21-22, hard to believe, our 6th year. So we're hard at work doing that. I'll also thank our 7 local sponsors at the intermission time in about an hour. And I also want to say hats off to the extraordinary staff at the Midland Cultural Centre and at Rogers TV for doing all the work you do to make this happen so successfully. During the first part of the program, we'll hear from the 3 speakers about how COVID has impacted their own personal lives, the lives of their patients, the lives of their friends, the lives of their colleagues. But I'm going to be carefully listening, and hopefully you will be too, for their suggestions to minimize the challenges that they're talking about. There will be an opportunity during the second part of the program, that's about an hour in, for some specific audience questions. And you can continue to forward those questions during the show. You can use the mcc_ourhealth@outlook.com email address, or if you're on Facebook Live, you can use their chat line. So either way, I'll get the questions. So look forward to it. Rob, at this point, can I ask you to start?
Hi, Keith. How are you today? Thanks for doing this, and thanks for bringing a spotlight onto mental health. It is so important. I mean, we have seen mental health really be impacted by the COVID crisis, and so I'm glad to speak about that today. So, I mean, I can start by just saying that, you know, when this started, oh gosh, a year ago, it seems so much longer because time has almost stood still. You know, we didn't think it was going to last this long. I remember saying to my patients, oh, you know, this will be over in a while, maybe a few weeks, maybe a few months. But it really hit and it kept going, and it's come in wave after wave. I remember in March of last year, my one daughter was in France on an exchange. We had to quickly get her out because flights were shutting down, countries were closing and borders were closing. We did that through Switzerland on our own, you know, on a plane, worried about COVID. We had no idea at that point how COVID was going to affect kids, how infectious it was, how deadly it was. We just saw terrible news coming from all over the world, especially in Europe at the time. And then, you know, my parents got sick. They both ended up in the hospital. My dad was in the ICU on a ventilator, survived. My mom survived as well. So that's how COVID started for us. And then suddenly we were locked down. Schools were closed and families just hunkered down. And that first wave, I remember thinking, okay, this is, you know, this is kind of a foxhole experience for families. You know, we're hunkered down, trying to keep safe. Most people were following guidelines. I remember driving on the road those few weeks afterwards. There was not a car on the road. Schools were closed, of course. Grocery stores were, you know, people were being very careful. Shelves were empty, as you remember. There was no toilet paper to be found. But really, you know, it was quite a scenario. And then it went on from there. I mean, there was a small reprieve in the summertime, I think. But then, you know, we had wave number 2, wave number 3, and we had milestones being missed. We had connections being lost. Schools were closed. Sports were canceled. Camps were canceled. And, you know, people were resilient. And I think through wave 1, people were pretty resilient and that elastic was able to stretch. But with every successive wave, we've seen more and more of these elastics just snap. And, you know, this third wave in particular has been really difficult for families. It's just to have schools kind of go from online to virtual to online and now back to virtual schooling for most students. They are not in school, they're missing their friends. They're connecting really just over social media. TikTok and Snapchat is sort of the main way they're keeping in touch with each other now because they can't be in large group. And telling teenagers they can't be in groups and with their friends, that's challenging.
Well, so it's had the most impact. The fact that we're distanced and separated, or the fact that we just don't know what's happening. And as it goes on, and as you say, there's been milestones made and not met, and things have happened. And, you know, we all love our politicians and our public health people, but they haven't known the end result either as we've gone along. So it's hard to know who to trust. It's hard to have any control over what the ending is. So is it not having any control over what's going to happen, or is it just the fact that we're so far apart and it's so difficult to just live?
Both. You know, anxiety is based on a loss of control and a loss of agency. You know, you don't have control over what your life anymore. You don't feel like you have control. And, you know, that's really what it has felt like. You know, we have not known what to expect. At the beginning, like I said, we didn't know, like, how serious is this? How deadly is this? Are we all going to get it? You know, the media didn't help. You know, there's a lot of hyperbole and a lot of, you know, you just heard the bad news stories. But still, you know, there was a lot of anxiety at that point. We know a lot more about COVID now. I mean, we've gotten used to almost living with COVID and the lockdowns and wearing the masks. But, you know, at the beginning, we didn't know that. And that was causing a lot of anxiety in kids. And we saw a lot of kids and families going like, what's next? Where do we go from here? But now it's also just fatigue. I think, you know, I see a lot of kids have just given up on school, for example. They've tried virtual. They just, it's just not working out for them. And a lot of parents are saying like, okay, we're just going to ride out this school year, do the bare minimum, and we're going to regroup hopefully next school year. So it was that anxiety beginning, and it's just real fatigue now. And the lockdown measures were necessary. The public health guidelines were there for a purpose. We had to stop this wave as much as we could and flatten the curves. And we have for a large part, done that with successive waves, but it's getting more and more difficult to adhere to those guidelines. And it's really, we see the impact on mental health, and we'll probably, as the medical impacts of COVID fade over time, hopefully, we're going to see the mental health impacts go on for years and years and years and years, because this has been a lot of stress on a lot of families, and especially in young kids, stress on the developing brain, and experiences that they see around them in their families. They've seen a lot of family upheaval, a lot of difficulties. 44% of parents report worse mental health, and 25% of parents report worse mental health in their children. I think it's probably even higher than that from my experience, but maybe I have a biased, population sample. But, we're seeing a lot of stress that flows down, through families, from parents to the children. And that's going to affect their development for years and years to come. And then their physical health as well. We know that there's adverse childhood experiences that are really literally being generated much more quickly during this COVID pandemic than they were before. And adverse childhood experiences, that's toxic stress. If it's chronic, if it's severe, and that can be really toxic for the developing brain, and that can affect mental health and physical health for years and decades to come.
Rob, you mentioned the increased percentage of people that are challenged with more mental health issues than ever before. Can you talk about the gradation a little bit? Because anxiety is perhaps worse. Well, I'm sure it's worse. Anxiety is worse. Fatigue is worse, you said. But which are the key areas that we should be really worried about that people are going to need assessment and treatment as early as possible? And which are the ones that we've got to be proactive as COVID prolongs itself? So can you because we can't treat everybody. So where should be our tipping point where you say those people, that section really we need to really do more work with them? Almost like the COVID vaccination pop-up clinics in high-risk areas, like.
Yeah, well, families who were struggling before the pandemic, we see them really struggling. We see that also even in couples. The divorce rate was pretty high at the beginning of the COVID pandemic, because couples that were struggling before it ended. And it was difficult to maintain relationships. So if you had families and kids that were having difficulties before the pandemic, they are going to be really struggling now, and we've seen that for sure. But the way to know, like, well, who see? I mean, all of us need treatment. We've all been affected. Okay, I guess I don't want to really say like, okay, that person needs it more than that person. Like, Canada is a hot spot right now. And, as much as we have, therapy is a finite resource, and medical care is a finite resource. I understand that mental health care is, but everybody needs to really look at themselves and say, okay, how am I doing? And if we're seeing significant day-to-day dysfunction, and that's relatively subjective from one person to the other, but if we're seeing significant day-to-day dysfunction, if we can't do what we used to do, if kids are not able to go to school, if our depression is keeping us in bed, if our anxiety is preventing us from going to places that we used to go to in the past, if our kids are saying things that scare us, or they are, not doing the things they used to do, that's the time to get help and to look for professional help. Honestly, I think sometimes we wait too late with getting help. We seem to kind of get it when things are in crisis mode. But really, you want to get help before the crisis mode. That's when you're most open to being helped by therapy and counseling. In fact, I think we should be doing that when we're doing well. I encourage all couples to go and for marriage counseling and do it regularly when you're doing well, because that's when you can work on things so you can be ready for the next crisis. So I would love to see our mental health care system move towards more of a preventative approach so that we're not just waiting for the wheels to fall off, but we're actually, helping these kids and supporting families before that happens so that we don't have these toxic and difficult experiences for kids and families to go through and then have to recover from.
What do you think? Talk to us about virtual learning and the challenges with virtual learning, and also both sides of it, because a lot of us think some of the virtual stuff is here to stay forever. Like it's not going to go away because it's more efficient. For some people, it's actually better. So can you talk to us about both sides of virtual learning?
Yeah, that's a great point, Keith. When the pandemic first started, we had the first lockdowns. I think, well, first of all, none of the schools were prepared to offer virtual learning, and no parent was prepared to be a home school teacher. And suddenly we were all thrust into this situation where we had to learn from home. And I didn't call it homeschooling. I called it remote learning. Really, that's what we were doing with our kids. They were learning on a computer screen with a teacher in a classroom. And, the Ministry of Education did as good of a job, I think, as it could in a very short time. Initially, remember, it was March break, right? That schools closed. And then it was a bit of an extended March break. And I remember thinking to myself, oh gosh, what's going to happen to these kids? They're all going to fall behind. They're all going to struggle in school when we do restart. But it's interesting when schools first closed, I had a bunch of kids in the initial month or so that were actually doing really well, and those were kids that I was surprised at. But it turns out for school for them was a huge stressor, and to kind of be off of school. Initially, it was kind of a prolonged holiday. But eventually, it was at home. It was a lot less stressful for them. And for those kids, some element of virtual learning might be useful in the long term, because we don't want school to be excessively stressful for them for whatever reason. However, as time went on, virtual learning, of course, improved. The quality of it did improve as with successive lockdowns and return to virtual learning for our kids. I would say right now, it is what it is. It's Zoom learning. I have 3 kids myself who are on Zoom platforms every morning, and it's different. It's not the same, though. Virtual learning is not the same as in-person learning. It shouldn't ever replace in-person learning. I mean, our school systems are set up on models of social learning. We learn from each other. We learn from our peers. And we learn much more than facts. We learn how to work together, how to collaborate, how to share, how to talk to one another. Things that are very, very hard to do on a Zoom or on a virtual platform. So I've pushed for this before. We need to have schools reopen as soon as possible. I mean, SickKids said it in their guidelines for schools in COVID. They said, they should be the last to close and the first to open. And I think as soon as our numbers start to drop and community transmission starts to decrease, we need to see schools start to open as soon as possible. It has to be safe, of course. That's why I'm hoping that, with the vaccine rollout and with, other precautions, we can make schools safe again. I actually hope that schools can reopen this school year. I know people are saying like, you're being too optimistic, but even just a few more weeks of school before the end of the school year would be so helpful for kids. It would be so rejuvenating for kids as we start to reopen other parts of our society. I do hope that, those that are in a position to make these decisions don't say, oh, it's just a few more weeks, we'll just kind of wait till next year. Honestly, I think even if we can open for just a few more weeks or a month or so before the end of the school year, it's worth it, okay? Because if we just say, well, the kids will be fine, they're not fine. They need to go back to school. Many of them miss school. They miss their friends. They miss those social interactions, even if it's behind a mask and socially distanced. I would love to see schools reopen, and definitely in the fall, hope many can return to really, in-person learning, but also some good stuff that we've learned from the pandemic, which is for some students, a mix of in-person and virtual learning I think, school will change going forward. We'll have more virtual learning, but the in-person part is critical for all students.
The three of you want to share what you've learned about virtual learning, because you're all doing your consultations with patients virtually, and a lot of your conversations that would have been meetings face-to-face, they're all virtual. What have you learned that makes virtual activities more effective or more interesting or more engaging? Because I'm sure there must be some tips that you could give our audience on that. Anita, what have you learned?
Well, I think that when we first had to shift to virtual learning, especially for therapy, and in eating disorders and other sort of addictions work, we're used to being in person. There's so much that we depend on when we're sitting with somebody in terms of our assessment and treatment planning. And I have to say that I've been really relieved to know that most of our treatments, our evidence-based treatments, can continue virtually. And so some of the things I've learned is that through COVID and moving to online learning, we've been able to reach people that we wouldn't have been able to reach before. We've had patients who have been very depressed or very down, who have shown up for their sessions, sometimes, in a robe and in bed, but they're showing up. And I remember one woman said to me, if this wasn't virtual, I would never have driven in. And the appointment really helped her feel better. So there's a lot of engagement in an ironic way by being able to connect with people, and not just in our own backyard, but we've been able to offer treatment for eating disorders and personality disorders across Ontario, where geography is no longer the barrier. So I think those are some positive ways that we're connecting and offering much needed services. And I think for people who are socially anxious and things like that, it can be tricky. It can be hard to be online. We were talking about that amongst ourselves before we came on tonight, but I think that there's some really nice ways that you can connect with people virtually.
Nicole, what kind of techniques have you put into your armamentarium to reach people and to be more effective in your conversations?
I think the most important thing that I learned was how to make it a psychological safe place to be. So making sure that they have permission to have their video off or on, allowing them to engage, in whatever capacity they feel they can in the moment. So using the chat bar and exercising their voice and respecting the fact that when we come into a virtual world, we're entering someone's home, like you're entering mine tonight. And that might be okay with me, but other people might feel vulnerable about it. So just making sure that we're covering all those spaces and then making it a place where all voices are heard. And we just enable people to take what they need.
So Rob, I'll ask you the question in a little different way. If I was to ask your three kids what they found most effective about virtual things, the things that resonated with them or worked with them, what would it be, do you know?
Well, when things were closed down, social media and virtual connection was really one of the only ways that they had to stay connected with their friends, which I think was vital. I often wonder, what would COVID have been like 20 years ago when we didn't have this kind of technology? So my kids have enjoyed it, and I've actually allowed them a bit more leeway to stay connected with their friends. I know we railed against screen time before COVID. We were like, no, less screen time, the social media and all the perils of social media, and those still exist. But I do think we need a little bit of grace and latitude to say to our kids, okay, hey, if you're just connecting with your friends and just chatting, we've lost so much. Do that, and do stay connected that way. And if it's positive, it can be so fulfilling for them. But school, it has been hard for them, other than the fact that they don't have to get up so early because, they don't have to catch a school bus and make their lunch and get dressed for school. They literally can just kind of wake up and grab some breakfast quickly and be on their classroom within sort of 20 minutes, which used to take, an hour and a half. Yeah. So in that way, they've been able to sleep in a bit more. So I do think they appreciate that aspect of it. But, in many ways, we've been able to keep in touch much better with social media. And we've been able to connect around the world with people. As Anita was saying, it has just allowed us one other option for just connecting with people who otherwise may not be connected or have connected, in other ways before.
So just before we flip to another speaker, you talked about toxic anxiety and rewiring the brain and some pretty serious stuff. Have you got some suggestions on how parents can take that and say, yeah, that's, if we don't do this, this is what might end up, but here's some things that I can do to try and prevent that or try and minimize the effect of that?
Well, I talk a lot about early life stress and how that affects the developing brain. And we know that, our brains do get rewired when they're exposed to toxic stress. There's positive stress, which is learning and it's good. There's tolerable stress, which is, that bad thing that happens occasionally that we can manage and we can cope with. But then there's toxic stress, which is chronic and severe. And that is not good for a developing brain. So we need to mitigate that. We need to actually avoid toxic stress, but we need to also provide lots of great positive experiences. I mean, the brain is not structurally complete after birth. It is wired through experiences, and our experience has shown that the more kids can interact with real people, and especially their parents, because that's who they are closest to at the beginning, that's who they have the closest attachment with. And that attachment is so important. Kids need a secure attachment. They need to have lots of face-to-face interaction, what we call serve and return interactions, where you do something and you look at your baby, you mirror back to them what they see. Whenever you do that, oxytocin just flows. There's this concept that I like in self-regulation called the interbrain, which is sort of that brain between you and your child that needs to be nurtured in the early years. I mean, most brain development happens at the very start, like literally within seconds after, well, it happens before you're born, of course, too, but socially it happens within seconds of being born. And in those first few months, it is literally like millions of connections per second that happen in the brain and that develop the brain. So that's when you want to have all those good positive experiences. You want to interact with your baby. You want to hold them. You want to make them feel comfortable, safe, and secure. And the more of those experiences we can give our kids, the better it is for their brain development. And, as they get ready for school and then forming their own social relationships, if you look at even adults who are in their 90s, the biggest predictor for happiness in the older years, the grant study, Harvard grant study is a good example of this, but adults in their 90s, the most protective factor was warm relationships in childhood, decades and decades ago. So that just shows you the power of those first few years of life in healthy mental and physical development.
Okay. Thanks for summarizing that. That's great. Anita, do you want to talk to us about your world of eating disorders? To be honest, a world that was challenging with lack of resources, more patients than therapists, so many different presentations for eating orders. I remember thinking back to your presentation in 2017. But what's changed with COVID? How have those patients become, what's happened to them?
Right. First of all, thank you for inviting me back to speak about this really important issue. And, like you say, eating disorders, we were already in a crisis as a field before the pandemic. And so now COVID has created, it's just exacerbated what was already an astounding sort of problem for us in the field to begin with. Recent stats from the Academy for Eating Disorders, sort of the international governing body, quotes that every 63 minutes, somebody dies as a direct result of their eating disorder. So every 63 minutes, and so this is a pretty significant number. And I don't think sometimes people realize the severity of eating disorders. They have the highest mortality rate than any other psychiatric illness beyond the opioid crisis. And so we are quite concerned in the field because we have seen a tremendous worsening of presentations and a real gap in service. And so, Rob, you did a great job of highlighting why and how COVID increases risk for people who are already vulnerable. And this is not just for eating disorders. I would argue this is for mental health in general. If you are already somebody at risk for depression or anxiety or substance use disorders, something like a worldwide pandemic is the perfect storm for those underlying even issues to start to develop. In eating disorders, we often say that genetics, genes load the gun, the environment pulls the trigger. And so, you know, for kids or for people that maybe did not have a problem but prior to the pandemic, but had the genetic predisposition, things like isolation, the lack of routine, changes to friendships and social connections, et cetera, these things create stress in the brain and can promote underlying conditions. So we're seeing sort of two things happen. We have a whole set of new cases that are presenting. So people that this is the first time and they're presenting because the stress has exacerbated what's been going on. And the other part is that we have a whole subgroup of patients for whom the treatments that they need to stay recovered, the connections, the resources, and a lot which would have been in person are no longer available. So, for example, CHEO, the Children's Hospital in Eastern Ontario, they are turning away almost 75% of their eating disorder referrals. There's just no room. I was talking to the Hospital for Sick Kids last week. Similar stats there, huge increase in referrals. They don't have the space, and an increase also in complexity, right? So what we're seeing is kids that have eating disorders, but also have co-occurring self-harming behavior, severe anxiety disorders, et cetera. And so these things are creating significant problems for our system that just can't manage. Wait lists right now, Keith, I would say are somewhere between 6 and 12 months, depending on adolescent versus adult. And for an illness that is brain-based and metabolically driven, these illnesses can't wait 6 months to 12 months for the treatment that would save their lives. So it's a big crisis for those of us working in the field.
Anita, do you want to just tell our audience a little bit about what you mean by eating disorders? Because I looked it up. That's why I remember 2017, what you said, but not everybody may have the definition of eating disorders and understand the complexity of them and how significant they are.
Yeah. Eating disorders as a term really is used to encompass quite a variety of different feeding and eating illnesses. So we say eating disorders, and most people think about anorexia nervosa. That's sort of the typical sort of thing that people think of. And anorexia nervosa is a very severe illness. However, it is one of the more rare eating disorders. Bulimia nervosa, binge eating disorder, ARFID, which is an avoidant type of restrictive eating disorder that we see often developing in kids. Right? So when picky eating and texture becomes a problem, can turn into something much more significant. So there's a range of disordered eating that I think is important that people don't just think of it in one way. We also know, which I think most people aren't aware of, is that eating disorders are what I would call neurogenetic illnesses. And these are biologically based, genetically driven diseases, illnesses. To me, they're no different than somebody developing type 1 diabetes or multiple sclerosis. You don't choose an eating disorder. They're not diets gone wrong or fads that kids are sort of, dabbling with. These are significant illnesses that require intensive intervention in order to treat. And so one of the largest genetic studies actually at a Chapel Hill showed that, and again, this was for anorexia nervosa. However, we think it has implications across the board, but adults with anorexia nervosa also showed abnormalities in the metabolic system, which makes sense. So there's something going on from a metabolic level that impacts food cues, hunger and fullness cues, the ability to properly feed oneself, et cetera. And so we know that there are sensory issues, and most of those reside or come from brain and brain development and some of the early learning also that Rob was talking about.
So of those factors that you talk about, that, I mean, I remember the last program, it was, don't blame people for having an eating disorder. It's not their fault. And that was a clear message that you had. But knowing that some of the things that are the metabolic and the genetic things are there, and you really can't change those. You have to work on the behavior, right? So you're working downstream.
Well, yes, and we still have a lot to learn about what we can and cannot change when it comes to brain and our neurophysiology. I would argue that I think there's a lot that we can actually do with proper treatment. We all have temperaments. You know, Rob, when you're talking about kids, thinking about my own daughter and thinking about her temperament right from the get-go, and now 9 years later, I still see her particular temperament. I'm not going to change that. However, you can help people manage how to work with a hunger and fullness cues that might not be as accurate. You can help people manage risk aversion, impulsivity. You can help people manage some of the things that, yes, they may be neurogenetically based. However, that's what our interventions target. And we have really great outcomes when people can get the treatment that they need.
Mm-hmm, mm-hmm, mm-hmm. So in your practice, and I don't know, how many eating disorders would you have in your clinic here in Midland? How many
I was looking at that, and I think what I would say about that, we have a significant number of clients with eating disorders and or their families. So sometimes the child, the adolescent, or even the adult, child, et cetera, is not able or willing to come to treatment. There's a lot that families, caregivers can do to help shape or influence what might be happening at home. So I often say to parents who are desperate on the phone, even if your loved one can't come in, won't come in, there's so many things that we can teach you that would help, that can help shape what's going on at home. So sometimes it's, so we have a range of different people that we see. We have an extraordinary number of referrals, though, right now. So there are some weeks when we have 30 to 40 referrals just over the course of a week, the majority of which are eating disorders. We are a personality disorders clinic as well, so sometimes we do get trauma and personality disorders. But the rates in eating disorder referrals have gone, in 25 years, I've never seen anything like what I'm seeing now. And this is not just me. I talk to my colleagues across the province and across the country, and it's happening everywhere. So the rates of referral, we've got a wait list right now, which always breaks my heart because I know people are so desperate, and we're doing everything we can.
So I appreciate all the hard work you and your staff are doing. What are some of the things that you've learned through COVID that you can, some of the things some of the hoops you've had to go through because of COVID, but what are some of the things that you've done to keep it alive, to keep these patients well? You still believe in what you're doing because you're working even harder to do it. So what are those things that you do that you find that help people?
Well, I think some of the hoops have been, how do you, trying to get creative, how do you get necessary weights and vitals when people can't come in to see you? Mm-hmm. Right? We rely on this. So, for example, it's incredibly important that we know what's going on with your weight, your lab work, your ECGs. We have to have that information in order to be targeting things properly in treatment. And all of a sudden, we've gotten better at it now, but all of a sudden, when COVID first hit, everybody was scrambling, and especially our public health system, which really had to shut down. So some of our eating disorder programs actually shut down. A lot of the follow-up care, so they could keep, let's say, inpatient programming going, but all that necessary follow-up care stopped. We were really scrambling as a again, as a field, in terms of how on earth are we going to do this when I don't get to see you, or when family doctors who we desperately rely on to help us get those weights and vitals are also swamped or being deployed to other settings. And all of a sudden we're saying, can you please do these, this lab work? And the docs are saying, yeah, maybe in 3 weeks. And we said, like, how are we going to do this? So there were all kinds of obstacles. As an eating disorder clinician, there are also unique things to treatment, such as we tell people to get rid of their scales. I don't want you having a scale at your house, because people will become very attached and can be obsessively weighing themselves, and it's not a good practice. Well, all of a sudden we've had to shift that, where if you can't come and see us, we kind of need a scale somewhere, because you can't just go somewhere and get weighed. And so we've had to get creative about how we do those things. And it's taken a lot of international thought, to be honest, a lot of backdoor sort of discussions about how on earth do we do this. But you know what? It's also been talking to our patients and talking to families. How do we make this work? And I've seen some amazing things come together simply because we're in a crisis and we have to figure it out. So there have been lots of hoops and things like that. As I said before, I have been so, I guess, pleasantly relieved, surprised that we can continue to offer services. I work with a lot of the local hospitals, and local and not so local hospitals, and I've been amazed at their quick response to try to get things virtually available, psychiatrist appointments, et cetera, all kinds of things happening virtually that did not happen before. So that's promising. I think the biggest obstacle, though, and I really want to validate people who might be listening tonight, and Rob and I was listening to you in this preventative piece, and I'm so with you. We do need preventative mental health treatment. And I know that there's so many people out there banging down doors, trying to get eating disorder treatment, and they can't get it. And that, to me, is the thing that we haven't been able to effectively solve yet, because it's a problem. If you're in the public system, you're waiting, like I said, 6 to 12 months. And that's just a nightmare. Mm-hmm. If you're in the private world where I sit now, that's great. If you have money, we can help in lots of ways. However, eating disorder treatment, when you're going to see a psychologist or a psychotherapist, you're going to see a dietitian, you're going to have meal support, et cetera, those costs add up very, very quickly. And so there's this incredible gap in services. And I know that our families and a lot of my patients are out there struggling right now, trying to find a way to stay connected. The good news is that there have been a number of incredibly helpful nonprofit organizations who have just risen. I think of Body Brave. I think of Need, who did that talk with me a number of years ago. I think of Waterstone Foundation. I think of so many incredible, NEDIC, who are offering services, groups, all kinds of things. Feast is one of my favorites. I believe it's on the resource sheet. They are fantastic, and they have a free 30-day support offering for caregivers. And it's just, these are outstanding innovations that we are seeing. And so we have a long way to go. And we're doing our best to try to meet those needs. So
Anita's taken the time to write some of those references down in the booklet that we've sent you. So take a look at them. I went through some of them, and they're certainly supportive, and there's information there that I hope you find helpful. And I think that's, yeah, as you said, that's one of the things out of COVID that's happened. More of those resources are available to people, but they also have to know when and how to access them. So thank you, Anita, and thank you to your staff who continues to work hard to manage the crisis. But thanks all for the glimmer of hope that we do get through a crisis, and we will get through this. So thanks. Okay. Nicole. Nicole has a few things to talk about, but I asked her, she'd say something about what has been the experience at Waypoint with the staff. What have you got? Well, I'm not gonna go out on a limb. How many? But you've got a lot of staff. How many staff would you have at Waypoint?
Approximately 1,200. So yes, it's a big group.
Okay, I was going to say 1,000, so I guess I wasn't too far off. But so, how have you supported the staff through the crisis? Long hours, worried about COVID, an outbreak there that affected one area, people died. I mean, I'm sure many of your staff was scared. They didn't want to come to work some days. They didn't know what they were supposed to do. I mean, there was so much confusion in some of the directions. So tell us where you were at in helping out some of these things.
Yeah, great question, Keith. Thanks. You know, when I've been listening to Rob and Anita talk, all I keep thinking about is that oxygen mask we need to put on first to take care of ourselves, and that's part of the responsibility of the workplace. So during the panic that Rob mentioned in the beginning, quickly what the organization did was just look at what resources they had in the moment that they could retool. So one really good example would be our trauma incident support team, where that team made themselves available to a greater degree every day, weekends into the evenings, to make sure that if staff wanted to reach out and get support, they could reach out to those team members, and those team members could provide a confidential listening ear and guide them to the right services to meet their needs. So that's one really key piece, was making sure that access was readily available to the employees. Another key element was our mindfulness programming. So we had a 12-hour mindfulness program that was really embedded in the organization, and quickly, I'd say within 2 months, we retooled it to a 2-hour online platform so staff could access it at home on the weekends, in the evenings, and basically just at a fingertip, get some skills and support services right away. So we needed to quickly react to that. Also, the organization developed services. So COVID Frontline Wellness was developed. So again, it was breaking down the barriers to access so the frontline staff could get services and they weren't waiting. And so that was a really important piece. And lastly, it was about making sure that people were aware. So having the conversations, making sure there was a lot of communications going on to share what was available and encourage people to reach out and get support. And, you know, during the really horrible outbreak on one of our units, what we saw was staff become this strong, rich community. Like, we've always been a really strong community culture at Waypoint, but you just saw all the employees wrap their arms around these groups of employees that were going in the outbreak, sending them cards, posters, gifts. It was a really beautiful way of saying, hey, we're here for you and you're not alone and we're together in this, and we might not be on the floor with you, but our hearts are with you.
Okay. Remember, Kevin shared with us the challenge with during the crisis and the outbreak of having to vaccinate people quickly, patients and staff quickly, and initially surprised that they didn't have the uptake of number of people volunteering to have the vaccination to start with. Were you involved in any of that? Because I know Kevin said you had to step back and make sure people know what they need to know about the vaccination to make an informed choice. And once they had that, then things were much better. But were you involved in that and the preparation behind that?
I wasn't involved. I saw Kevin's video and it was extremely informative and very powerful, and certainly gave people the information they need to make the choice that was best for them. But I wasn't involved, so I'm not sure I could speak to that very, very much.
You talk about self-care and looking after yourself. One of your references, I'm not sure which one here, but one of them has some monitors to measure your health. How am I doing today? Do you want to explain that? What that contains? I've seen you use a thermometer. I've seen you use a two-dimensional model. Give us some ideas on how we measure how we feel in the morning when we get up.
Yeah, so that's just a quick temperature thermometer, basically emotions thermometer. It's just a simple tool that's level 1 to 5, where level 1 is, you know, I'm not doing so well, I'm struggling and I need some support. And level 5 is, I'm feeling resilient, I'm doing good. So the intention of the thermometer is just to take a moment to check in, because as adults, we need to check in with ourselves and just check in and see, how am I doing right now? And, you know, when I'm doing this way, how am I feeling and how am I going to show up when I'm engaging with others? So it's an opportunity to grow your emotional awareness and your social intelligence when you're interacting with other people. So just a really simple tool that we're using at Waypoint to promote the conversation about mental health.
And are people pretty honest with it, doing it? Or do you have some people that are at once, they think they're at one scale, but they're actually at the other scale? And how do you handle that?
Oh, good question. Yeah, we use it a lot in the mindfulness classes, and you'll see some people will be honest. It really depends on the comfort in the room. But then sometimes you'll see everyone follow a certain trend, like, you know, all rating themselves as really high because maybe they don't want to be the person in the room to say, I'm not doing so well today. So it's really important when we're using the scale to address that. There's a dichotomy here. And it's okay to be anywhere that you are on the scale, and just to not judge yourself and be aware of it and share, because, you know, not everyone's going to be happy all the time, and we all need to respect where one another, how we're feeling.
Yeah. Okay. Honesty on that scale is better than hiding it, because it's not your fault. It's never your fault on where you are on an emotional scale. It's nothing. It's just where you are, right? So,
exactly.
Okay. Okay, thoughts on where people go for help?
Well, we have a lot of help out there. If somebody wanted support, when we look at Canada as a whole, there is Wellness Together Canada, a really great website where people can go to get 24/7 support. It's free, it's private and confidential. It has texting for youth and adults, and it also has programs where you can do self-assessments. So it's a really great tool, and I encourage people to go and check it out. So again, it's Wellness Together Canada. Provincially, if you wanted to.
It's Hope for Wellness Helpline. Here it is, Wellness Together Canada. Okay, it's in the first page of references right near the bottom for anybody who's looking at it. Okay, sorry.
Yeah, that's okay. So in Ontario, I'd suggest going to 211.ca. Again, there's another location where there's a variety of resources where you can get information and referrals to the community, government referrals, social support services, mental health resources. So it's just like a bucket of tools where someone can go to take a look at what's available in their area and find the right professional to guide them and support them for their needs.
Okay, thanks. I know one of the things that we talked about at the very beginning was the work you've done on mindfulness and taking that course from 12 hours to 2 hours. How about in the next 5 minutes or 6 minutes, can you give us an overview of what mindfulness looks like?
I sure can. So
I'm not giving you an impossible assignment here, Nicole.
No, not at all. Mindfulness is just being aware. So it's intentionally being aware in the moment and being non-judgmental about what you're experiencing. So I think the best way to give you the experience is to do a practice. So if that's okay with you, I'm going to engage the group in a little practice.
You mean the group, the three of us that are sitting here?
Yeah.
Or just the other two? Okay, go ahead.
Anyone who's willing, how's that sound?
Okay.
So what I'm going to ask you to do is just take a moment and ground yourself by placing your feet on the floor and just paying attention to your feet right now. Feeling your feet touching the ground, feeling each part of your feet connect, and drawing your attention away from your busy mind to the furthest part of your body. Okay, I'm going to ask you to grow your spine nice and tall, like the trunk of a tree. And if you feel like you can close your eyes and you feel safe, please do so. And if you don't want to, that's completely okay. just gently gaze downwards. And I want you to breathe. Just pay attention to your breath. You don't need to breathe in any special way. Your body knows just how to breathe. Focus your attention on the flow of your breath, breathing in the new, and release. If you notice your attention wander or something come to mind, gently and kindly take notice of what's distracting you and draw your attention back to breath. Breathing in the new and breathing out and releasing. And guide your attention back to your surroundings by fluttering your eyes open. And just noticing what's around you. And taking a moment to reflect on what that experience was like for you. Knowing that there's no right or wrong, no good or bad. Just being aware of what it was like for you to try to take that moment. Thank you for sharing that with me. And I wonder if anyone here tonight with me would be willing to share what that experience was like for them.
I can start. I was impressed that I was able to let go. I actually stopped keeping track of the time for at least 3 minutes, and that it amazed me that I could do it. So that's probably the most important thing for me, that I could do that in the moment.
I agree. I am just astounded, Nicole, that something as simple as breathing, which I tell a lot of my patients to do as well, and we should all do ourselves, can just calm your mind down very quickly. I mean, we know how physiologically we're getting a sense of how that works now, and there's more and more research into how this works. But it's so simple to do, to be connected with your body and how you feel. We talk about teaching the 3 R's in school: reading, writing, arithmetic. We should be teaching regulation, and part of that should be mindfulness. Mm-hmm. Mindfulness-based stress reduction is just so important. So thanks for bringing it to our attention today.
Mm-hmm. I just appreciated also the words, your voice, sort of the way that you described it. And I love the idea of breathe in the new, and just that reminder that every moment is a new moment. It may feel like a very long, 15 months or whatever, and there's still newness there. And I just like that idea of reminding myself. Yeah. Mm-hmm. Thank you.
Thank you for sharing that. And I just want to highlight that mindfulness is a practice. And, there's some days that it's going to come really natural, or some moments where we really appreciate it and we can, get right into that awareness. But there are some times where it's just our minds are just distracted, and we have to keep practicing to make sure that we can benefit from those 30 seconds that we just shared together.
So what have you done with mindfulness as part of your therapy? I know you've got a course. Is the course for people that need it because of anxiety and because it's just time to do something different, something new? Or is the course to teach other people? How are you using that, Nicole?
Well, first and foremost, the course that we share isn't therapy, it's a skills course. So there is therapy that clinicians use with mindfulness, but we just teach skills. So what we do with this experience is share with people all the different types of mindfulness that they could engage in, and get them to reflect on when they could use it. So mindful movement, mindful listening, the body scan. So we just try to spend a little bit of time caring for these care providers, giving them an experiential learning experience. So they walk away going, aha, I could use that before I go to sleep. Or, okay, I can use that when I'm transitioning from work to home to leave behind my busy day and reframe myself so I'm ready to be home with my family and present. And just so they can also manage anxiety, manage stress, increase their resilience, increase their empathy for self and empathy for others, and manage their emotional exhaustion.
Thank you. Thank you to all of you for participating so effectively in the first half of our program prior to the question period. It's been enlightening. Your experiences are horrendous across your world, so thank you. At this point, I'd like to take a very short intermission, and that doesn't mean you can get up and leave, audience members. I want to express our sincere thanks to our sponsors. I think there's a slide in front of you showing you their logos. They offer us lots of support. They respond to our social media. They like us all the time, but they also give us advice as to what's working with our program and what's not working. So we appreciate their work. So let me read them down. Georgian Bay General Hospital, Gail Hunt and her wonderful healthcare providers up at on Penetang Road. LabX Media, that's Bob Cafto and Jamie Burns and their group of scientific experts. The Center for Psychology and Emotional Regulation, Anita Federici and her many associates. How many people have you got working down there right now, Anita?
We have 19 now. There's 19 of us now. So, yeah.
Amazing, amazing.
Yeah.
And to Audia Hearing Aid Center, Andy Audia and his staff with several offices throughout Simcoe County. Hillcrest Village Care and Center, that's Walter and Jonathan Enns and their very dedicated staff, and certainly some of the challenges they've been through with COVID and long-term care patients. To Mink Insurance, David Mink, now referred to as the McDougall Insurance family. And to the Lipton Group, that's Lois Lipton and her group of real estate brokerages, investment and developmental companies. To all 7 of you, our sincere thanks for sponsoring the Our Health program for all 8 events in the 21-22 series. Thank you. Sorry, 2021 series. I'm gonna get ahead of myself here. Okay. I wanted to say a bit about our next program. It's on June the 3rd. That's 4 weeks tonight. It's called Successful Aging. If some of you take back to about 14 months ago, we had planned to do that program at that time. We have deferred it, and we're very fortunate to be able to attract the same speakers to participate. And they are Jane Sinclair, who's been instrumental in planning and designing services for the aging in Simcoe County. Lisa and Susan from Baycrest, very wonderful people who work at Baycrest, a hospital in Toronto that specializes for geriatric healthcare, education, and research. And we're looking forward to their presentations. And what would an aging program be like in our area without Kevin Young, who's coming back to talk to us more, this time about the normal aging process. So hopefully we'll see you all 4 weeks from tonight, and we'll see another 4 amazing speakers join us. So at this point, we're going to flip to questions to our panelists. We're going to see our chat line at Facebook Live and see where we go. So I've got one here. I've got some simple ones here that were here before. So one, Rob, is for you. Nobody said anything about pets. Are pets good people to have a social interaction with? I mean, a lot of people are buying pets for they call them COVID dogs and COVID animals, I think, right now. What's your thoughts?
Sure. Yeah, no, for sure. I don't have pets because, our house normally when we're not in COVID is generally empty during the day. And so we have lots of kids in here, but no pets. But still, I know lots of families and lots of kids who do benefit from dogs, from cats and hamsters and whatever it might be. Animals are therapeutic I know many therapists who have dogs in their offices because they have this ability to connect in a really a nonverbal way, of course. And I know equine therapy is very commonly used with kids with autism and other conditions, and it really is powerful for them. So there's something about animals that makes us feel good, and even for people who live on their own. I know for the elderly, for example, I'm a pediatrician. Here I am talking about the elderly, but that to have someone to share the house with, whether it be an animal, a dog or a cat, is very therapeutic. So absolutely. And plus, for kids too, it can teach a lot of responsibility to take care of something that is actually more vulnerable than you most of the time, and needs your care and attention. And so it can really be powerful for just teaching those skills.
Okay. Have you ever heard of the term languishing? I'll open up this to whoever wants to enter it. Languishing. It's when somebody says to you, "How do you feel today?" And I don't know every day if all of us get up in the morning and say, "God, it's a wonderful day. The sun's shining. It's going to be great. I feel so wonderful." Not every morning, that's for sure. And yet, we don't want to admit that we're really down in the dumps today either, and we might be some days. So languishing, I think, is a term that fits somewhere in between really good and really bad. Have any of you used it or any experience with that term?
I actually just saw a post on that today. So I don't think I've used it, but I certainly know what you're talking about. And I think a lot of people are finding themselves in that. And I read a comment that somebody said, "Oh, that's what it's called." Like they were glad to put a name. I'm languishing. That's actually what's happening. And it's powerful when you can observe and describe what you're feeling, even if those are uncomfortable feelings or not always happy feelings.
But it's a nice term. Like there's nothing, as you said earlier, Nicole, being non-judgmental is really important in a lot of the work that we do. And languishing just seems to be a nice term. It's not perfect, but it's nice. Rob, any experience or any thoughts on it?
Well, it's certainly trending right now, as Anita just mentioned. I came across an article too. Yes, I think it was the New York Times talking about languishing and how it's the term to describe our current, milieu and general sort of malaise that everybody's feeling at the end of the pandemic. We all want to get out. We all like to see the light at the end of the tunnel, but for now, this is dragging on, and we're languishing, which actually I don't think it's that positive of a term. Actually, I don't want to be languishing. I'd like to be thriving, and I think that's kind of the opposite of thriving. So I hope we don't languish for too much longer.
Okay. I just found it somewhat comforting, to be honest.
Okay, you can keep languishing if you want, Keith, but I might switch to
in order to help you when you were languishing. The idea was to choose something that you could do that wasn't threatening and that you could actually see progress. So it creates a step for you in moving in a different direction. So that's what I found very, very helpful with it. So anyway, talk to us about boredom. Yourselves, your kids, your patients. How do you approach boredom? Because
I'll tell you what.
Okay,
Keith, I think parents should be able to hear the words "I'm bored" a lot more and be fine with it. Boredom is often the springboard to creativity and thinking of new things and thinking outside the box. I think, and I said this a lot before COVID, COVID unfortunately has brought maybe a bit more boredom to people than we would like. But prior to COVID, I think we were overscheduling a lot of our kids, and we were feeling like we needed to kind of be in charge all the time and give them something to do at all times. And, hearing a child say, "I'm bored," was considered to be, not good. However, I think kids need to sort of have more unstructured time And when they say, I'm bored, usually, if you can let that go, is the start of something new for them and thinking about something new to do. So I don't have a problem with the word bored. However, like I said, in COVID, you know, I think we've all had a bit more of some things than we wished for. You know, prior to COVID, we always thought, hey, I wish I had more time with my family. Well, suddenly you're in lockdown, you're with your family like 24/7, and maybe it's a bit more than you wish for. So boredom is another one of those things where, okay, sure, a little bit of boredom is good for our kids, but maybe they've had a bit too much of it over the past year. So let's get back to, you know, quote unquote normal, and that hope for the occasional, I'm bored, mom or dad.
Anita, your thoughts on boredom?
I think for the folks that I work with, I think, you know, we live in a society, as you're saying, Rob, that is chronically distracted. That's what we're used to. That's the norm, right? This forever multitasking and juggling 5 million things. And I think COVID hit the brake, you know, real hard, real fast. And a couple of things come from that. One is, you know, how do I deal with this emotion? I'm not used to this emotion because I'm used to being able to distract myself whenever I don't feel good, right? Then there's this other layer of, so when people struggle with addictions, eating disorders, et cetera, being alone with oneself is incredibly difficult, uncomfortable. And so it may come out as boredom, but sometimes as a clinician, I talk more about, like, tell me what you mean when you say you're bored. Right. And some people feel, you know, understimulated, but others feel they don't know how to be with themselves. They've never really developed that skill. And that's where mindfulness comes in. Right? Yeah.
Okay, thanks.
Yeah, we do have to be careful because sometimes boredom can be, you know, a sign of depression too, right? Like they might say I'm bored, but really what they mean, I'm not motivated.
Exactly.
I've lost all motivation, or I just feel hopeless. That's not bored that I'm talking about, that good bored that leads to creativity. That's boredom that can be depression too. So we have to be careful about that.
Okay. And I think whether you're languishing or you're bored, you're still sitting with an emotion or a situation where it's uncomfortable. And it's how do we make sure that there's tools in the toolbox and a healthy plan for how to cope. So when we're feeling this way, there's a plan in place, and you know you're pulling to a healthy habit and demonstrating some really good coping mechanisms. So when our kids are bored, they go to something that is going to fill their cup and help that elastic band get a little bit stronger so it doesn't snap, right?
This one's for you, Nicole. Somebody said, I'll read it to you. A family friend would like to know if there are any free or low-cost counseling or therapy locally for young people with phobias and anxieties who do not have access to any kind of benefit program. So in the list of things, which of those are free for counseling services?
Well, I mean, the first thing I would say is access, see if there's an employer that has an employee and family benefits program. So like if a parent has access to those benefits, that's going to be the first go-to, and they're going to set them up with services, and it's going to not cost them anything. Outside of that, I would say go to Waypoint's website. There is the Ontario Psychotherapy Program that's listed on there, and there is also links on that website to other services that are available. For youth and mental health resources, that's not something that, I mean, I think that we have two people here that could speak to that better than myself, but off the top of my head, there is the Kids Support Hotline that they could contact. And going back to that Wellness Together Canada, there is youth services there too. So I would say your first step is to access your employee benefits program if you have one, and then reach out to the Waypoint website and see what resources are readily available right on there.
And I think Nicole just threw the kids section to you, Rob. So,
yeah, no, for sure. And I'll just say that, you know, there is, of course, NewPath and CANARC, which are our local lead mental health agencies that do provide counseling. A lot of it is virtual now, but it is still available. And hopefully it will be more in person as time goes on. It's walk-in for NewPath. If you're in the Muskoka area, Family Connections has walk-in clinics. and Hands in a Perry Sound area has counseling and therapy available as well. There's also the North Simcoe Family Health Team has some counselors as well. Your family health team, wherever you might be, whether you're in Collingwood, they have child and youth workers, and Muskoka as well. So there are definitely some options out there. Of course, you know, there usually are some wait lists for some of these services, but that'd be a good place to start. And also for the older kids online and adolescents, you know, we have Big White Wall and Bounce Back, which is available as online resources for the, I think, 16 and over age group.
Okay. I think one of the challenges with these things is telling people to go to a website and giving them a list is not as easy as if somebody says, well, here's a couple of options, like somebody knowledgeable says, here's the ones that a lot of my patients find helpful. And if we just Google help for anxiety, it's not going to give us that personal message around on how to choose. But so it's helpful to hear from each of you your suggestions. And we all know this program is available for those who want to watch it later. So if you want to hear those personal suggestions, you can do that. Anita, somebody asked about I needed medication for my anxiety and depression. I can't afford it. What can I do?
I'm assuming then that person is also struggling to afford services as well, right? So if they're not able to afford medication, and I think, again, what I would look for are the resources that have come up that are from nonprofit organizations. You know, Nicole and Rob have also highlighted some places to go to. I would be reaching out everywhere that I could to try to find support. So there are, you know, I think Waypoint, Nicole, you can speak to this. I don't know if there's free mindfulness programs, but I know Chigamek is doing some of that for free, where you can, you know, do Mindful Mondays. These things make a difference. So I'd be looking at, I often encourage people, contact your local resources and see what they're offering. A lot of them, a lot of the family health teams, a lot of the organizations, even the private clinics, you know, we often try to do as much as we can to offer free services, you know, and it sounds like self-promotion. I'm really not. I think a lot of my colleagues, you know, in our area and beyond often bring in students. And so the students, we can often do therapy for free or for very, very low cost. So I would encourage you, look around sort of who's in your region and ask them what resources they might have already developed. I know there's a number of things that will be delivered in the coming months as well. So things are changing rapidly. Keep asking people, keep phoning, because there are resources out there, and it is hard to find when you have no benefits and no extra money. That is a really tough place to be.
Okay. Thanks to all of you. Anita, the next question is for you. Is it normal for people to turn to unhealthy foods for comfort? And when is that too much?
So the first thing that I would say is, from my perspective, there's no such thing as healthy versus unhealthy foods. Food is food. You know, we live in a culture that is dominated by sort of a diet industry, a sort of weight phobic sort of society. So we really work hard to challenge that idea of healthy versus unhealthy. We want people to eat in balanced ways. And I also don't want to overly pathologize food as self-soothing. I'm Italian in terms of my background, and we are big foodies. We like eating. It's part of how we comfort each other. It's how we get through crises and happy times. And so that's a really big part of coping. So I want to leave some room for, it's okay. It's okay if you've gained some weight over COVID. It's okay. You are surviving a pandemic. So I don't want to overly pathologize what I think diet culture is jumping all over right now in terms of weight, shape, and sort of eating. However, I do think that some people, again, especially if you're vulnerable, if you have any history of an eating disorder or depression or substance use or mental health issues, you might overuse food as a way of self-soothing. So it may become a way that you're binge eating. And it's sort of out of control and you can't stop yourself. And there's a lot of shame around it. And that's when I would say maybe talk to somebody who can assess or figure out is this within the, the sort of guideposts, or is there maybe something else going on here? The other side to look out for is that other extreme where people get really rigid around eating. They're not eating a lot, especially in the absence of routine. When they're not maybe at work and there's, okay, everybody's breaking, let's go have lunch. Nicole, let's go meet for lunch. I'm at home all day long. And so what's happening is you've got people not eating. And for someone with particular eating disorders, not eating is a way of soothing what we call an unsettled biology. So it is something to be paying attention to. How is my eating? And I always say to people, you can't be emotionally regulated and have unbalanced eating. Those two things are not going to fly together. They don't work together. So it is important to pay attention to.
Thanks for your comments. Great. Question here. How long will the effect of COVID linger after the mass vaccinations programs roll up, after they're successful? When 90% or 85% of us are all vaccinated, how long will the effects of COVID go on? And what are you seeing as things that you're going to have to do to be proactive as some of those lingering things go on?
Well, that's sort of an epidemiological question, and the jury's out there. The last I heard was like, are we even going to reach this magic number of herd immunity? That 80 or 90%. We've seen some vaccine hesitancy. I would encourage everyone to get vaccinated. It is really going to be so helpful to drive down the numbers in our community, and also to drive down the possibility of, a variant forming and coming to light. So it's important that around the world we get as much vaccinations in so we can really try to.
So agree from our physical health and infectious status, that's important. What I was looking more, Rob, is at our mental health, that we've spent 14 months doing things that we don't normally do, and all of a sudden we can go out. Or won't happen all of a sudden, I'm sure. But our lives will change. They'll gradually go back to the way, or maybe they won't, the way they were 14 months ago or whenever it was we started in this. And how do we adapt to that? And what people will adapt quickly to going back to where they were, and what people won't? That's what I was trying to get at.
Sorry, I misunderstood your question, but it's a very good question, because honestly, we have to think, what normal are we going back to? Because we've all had a hard year plus. And, I think we all need to look and say, what are some things from my past before COVID that I'm going to go back to versus, what can I take from that was good that I'm going to continue with and add to and grow from in the future? I mean, there are some things that we don't really need to go back to. I talked about, overscheduled kids as one example. Maybe we've seen the benefits of more family time and family dinners while we were in lockdown, and we need to keep some of that. One of the things that one of the studies showed was that families who went through COVID reported more negative interactions with each other, but they also reported more positive interactions. In other words, there were just much more family interactions in general, both positive and negative in every family. And I think that's a good thing. I think we do need more. And the family unit is the key. Our support structure, it is a central part of our support system. And the more we can leverage our family, and whatever that looks like, that families are different for everybody. But, those key people around you that you're growing up with and growing with, how can you support those interactions as opposed to having 1,000, Facebook followers that just kind of like what you post. So those close, intimate, caring relationships, I think, is what we want to nurture going forward.
Thanks for those tips as we continue to ride through this challenge. Okay, I asked each one of you if you would be prepared to give us a quick key message, and it's got to be quick, I'm sorry, but sometimes that helps our audience too. So can you each give us a quick key message out of tonight's event? Nicole, do you want to go first?
Sure, I can go first. My key message would be access services. If you're an employer, see what services you can bring in for your employees and make them aware. And, just for an individual, access services, check in with yourself and take that pulse of your mental health so you can be ahead of it and care for it, and check in with others. We're all in this, and we're all on this pathway with this crystal ball in front of us. And we just need to stay together and demonstrate compassion.
Okay, Rob, quick comment.
Yeah, I would just encourage all families out there to learn more. Take the opportunity, like I said, when we're doing well and when we're recovering from this, to really think, how are we going to face the next stressor? Because life is not about removing stressors from our path. It's moving fluidly from one stressor to the next. And if we can help families to do that, that's key. I had a bunch of resources that I've listed in the resource list there, which are primarily just books on parenting that I've really myself benefited from. Pick up a book like that and learn about self-regulation, learn about collaborative problem solving, learn about being a connected parent, learn about how, behaviors are not just the one thing to positively or negatively reinforce, but they are the tip of the iceberg for something bigger underneath. Learn to ask why am I seeing the behavior in our kids? And how can I be a parent that responds to that? That's sort of, building that relationship with my children so that, next time something like a pandemic happens, heaven forbid, we're ready for it and we can be more resilient and get through it.
Thanks. Anita, making your very difficult calls because I'm getting the hook that we've got to get off the line shortly. So can you make your statement?
Yep.
Sure. Thanks.
Just to add, don't give up hope. I know there's a lot of hopelessness. I know there's a lot of discouragement out there. Don't give up hope. One of my favorite quotes is, learn to rest, not quit. I know it's hard. I know you're struggling. I know that there are not enough resources sometimes, and, keep going, stay in the game. We're doing our best to get to you.
Thank you. Thank you. Thank you to you all. You've been such a great group of participants. You've given freely of your time to prepare, to be with us here tonight. You all have busy schedules that get upset every day for the things that you're doing every day to help people. So thanks for sharing your experiences and your passion with what you do. So thank you. To our audience, it was great to see you tonight. I'm so glad you're here. Our programs are available afterwards. You can access them either through the Rogers website or through the Midland Cultural Center, our health website. And this program should be up and running for your colleagues, or if you want to go back and refresh yourself within a day. So take the opportunity to look at it again. If you have feedback for us, just email us at mcc_ourhealth@outlook.com, and we're happy to take your messages. So to all of you, thank you. To the audience, thank you. And to our sponsors especially, thank you. We will see you 4 weeks tonight at that Aging Successfully. Look forward to seeing you then. Good night.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
In any given year,
1 in 5 people in Canada.
1 in 5 people in Canada
will personally experience a mental health problem or illness.
By age 40, about 50% of the population
will have or have had a mental illness.
Rogers TV is a proud community partner
in supporting Mental Health Week.
#GetReal
about how you feel.
#GetReal about how you feel.
Now you can enjoy the Amazon Prime Video app on Ignite TV. Just say Amazon Prime Video into your Ignite voice remote and watch Amazon originals like The Expanse.
They wanted to fight. We'll give them one.
The Wilds.
Are we in the actual Bermuda Triangle?
And The Boys.
That is amazing.
Prime members can stream Amazon originals, movies, TV shows, and more on Ignite TV today. Now you're in command.
You're watching Rogers TV, Midland.
Hello, my name is Dr. Joanne Bazubitz, and I am the President and CEO of the Royal. Today, I'm having a special conversation with someone that is well known around the world for her courage in speaking out about her mental illness. And that person is Margaret Trudeau. For the Royal, Margaret Trudeau is a beacon of that hope, of optimism, and transformation. After years of suffering and silence from a then undiagnosed mental illness, she sought help from the Royal. Once diagnosed with bipolar disorder, Mrs. Trudeau was treated and found the ability to live life fully again. Since then, she has dedicated her energy to speaking